Elizabeth, thank you for demonstrating today.
Sure.
We just want to demystify what happens, why chiropractic works so well with pregnant ladies as well as all us other spine owners. So you started this about in month 5 around, right?
Yeah. I think it was about 20 weeks, 24 weeks.
Okay.
Yeah.
Your husband was noticing you were moving slowly and not so comfortable.
Yeah.
But a lot of times the OB or the midwife will have the same findings and recommend that a mom-to-be get checked chiropractically because it's going to get rid of pain or minimize pain instead of say get rid of. And it sometimes helps with morning sickness. Did you find that?
I didn't really have morning sickness, but it helped mostly with sleeping, with just general comfort in all positions. So yeah, I highly recommend.
Thank you. So the deal is when the baby is here, the center of gravity shifts forward and the lumbar spine ends up going in this direction with the baby, and then we get facet pinch. In other words, the back part of the vertebra, not so much disc problems up front. So to shape the table, we drop the midsection. Most chiropractic tables will have that option. And then we go, bring this down, and have this shape for a little extra space. Okay. The baby fits right in the and so we're checking for muscle tension. We'll use the decompression here so it opens up. There we go. With this expansion of the joint, we get nerves unpinched and help those facet joints glide the way they should. And the baby likes it too. Baby can feel a wave of motion in the fluid, but also the nerves that are better able to communicate from the lumbar spine to the placenta, the uterus and ovary. The amount of stretch is okay for you, Elizabeth? Now we're going to use a little drop action of the table. It makes kind of a noise, but it is very gentle. There's just a rocking that happens. Just the bottom section of the table will bump up slightly. And then when it drops, we get an assist from gravity in the sacrum coming right under the 5th lumbar, the way it should, once again. Good. And let's help around the diaphragm, where the diaphragm connects to these vertebrae, where all this pressure from underneath of the diaphragm. We want to facilitate breathing. Deep breath in and let your air go. Breathe again. And relax. Good. This is all very gentle. Sometimes you'll hear a little click when it moves. A lot of times you won't hear anything at all. It doesn't really matter as long as the joint is moving again. Yeah, you're gonna feel this one a little bit. Acupuncture points that relate to the lower cervical spine. And now we can turn over. Well, the other good thing is that moms who are prepared this way before delivery, it happens way easier. Less, the pelvis is flexible and have an easier time in the birth process. At least that's what I hear from midwives and OBs. And my own family experience has been the same. So we're going to do a little lengthening all the way through the spine. Teeth are together. There we go. Very easy. Good motion there. You haven't had too much swelling with ankles and legs either.
No.
Okay, and we're coming up. So it's like any day for you. Next week is due date, isn't it?
Next week is due date. So yeah, you can do this all the way up to delivery.
Exactly. That's a good point.
I wish I had started sooner.
Thanks for saying that. Yeah, the sooner we detect, I mean, mostly people have, maybe if they haven't been to the chiropractor before, may have some misalignment that's just built up over time. And pregnancy is just a time where it shows up. It's been there a while, and you've done beautifully. Thanks again.
Yeah.
Say hi to our.
All right. Perfect.